Welcome to episode 260 of the Pharmacist Voice podcast. I'm your host, Kim Newlove. My guest today is Commander Kendra Jenkins. She's a pharmacist and an officer in the United States Public Health Service Commissioned Corps. During our interview, we discuss her career as a public health pharmacist, settings she's worked in, roles she's served, deployments she's been on, being a boy mom, she and her husband have 2 sons, advice for students and pharmacists who are considering their career options, and more. If you're interested in a career in public health, you need to listen to our conversation. But first, if you are new to the Pharmacist Voice podcast, welcome. Again, I am Kim Newlove, your host. I am a pharmacist by training. I graduated from the University of Toledo College of Pharmacy with my BS Pharm in 2001. My clinical experience includes hospital, retail, compounding, and behavioral health. As of 2017, I am not in clinical practice anymore. I am a voice actor and a podcast host. I specialize in medical narration and podcasting. The name of my business is The Pharmacist Voice, and the name of the podcast, of course, is The Pharmacist Voice Podcast. You can find both the business and the podcast on my website, thepharmacistvoice.com. You can also find the show notes for this episode on the same website, thepharmacistvoice.com. Click on the podcast tab and find episode 260. Let me share Commander Jenkins' bio with you, then we'll dive right into the interview. Commander Kendra Jenkins is a pharmacist and a commissioned officer in the United States Public Health Service. She completed both her Doctor of Pharmacy degree and Specialty Drug Information Pharmacy Residency at Mercer University College of Pharmacy and Health Sciences. After that, Dr. Jenkins completed a PGY1 Managed Care Pharmacy Residency with the Department of Defense / TRICARE Pharmacoeconomic Center in San Antonio, Texas. After completing those 2 residencies, she was reassigned to the Defense Health Agency in Falls Church, Virginia, where she supported the Pharmacy Operations Division and the TRICARE Pharmacy Benefits Manager or PBM contract. She also held assignments at the Department of Homeland Security in Immigration and Customs Enforcement and the Centers for Disease Control and Prevention, or CDC, as the chief of the Pharmacy Benefits Unit for the World Trade Center Health Program, supporting 9/11 responders and survivors. Commander Jenkins joined the Bureau of Prisons in August 2022 and is now the Chief of Pharmacy Logistics Support. Kendra can most often be found spending time with her husband and 2 sons. In her spare time, she enjoys cooking, traveling, and community service. She is passionate about mentoring and takes every opportunity to discuss opportunities in managed care with pharmacists. Without further ado, here is my interview with Commander Kendra Jenkins. Hi, Kendra. Welcome to the Pharmacist Voice podcast. How are you?
I'm doing great, Kim. Thank you so much for having me on today.
My pleasure. Happy New Year to you.
Same to you, 2024.
I know. Oh my gosh, it is here.
I can't believe it either.
Yep. Any predictions for 2024?
I feel like it has to be better than 2023. For me, at least, that's personal. But I think it's going to be a good year. It started off pretty good on our end.
The Browns are headed towards the playoffs. So for my husband, 2024 is headed off to a good start.
There you go. Well, I can't say the same for the Eagles for my husband, but we'll see what happens.
Oh, okay. Eagles fans. All right. Well,
Yes.
I have a friend who works for the Eagles organization. And when I'm not rooting for the Browns, if they're playing each other, then I will root for the Eagles.
There we
go.
go.
Eagles.
There we go.
All right. Predictions out of the way. Now, I want to talk to you about your career as a Public Health Service Commissioned Corps officer. I'm so happy you could be with me today. Can you talk about what is your role with the Public Health Service Commissioned Corps, and how did you get from pharmacy school to where you are now?
They really say that the public health service is pharmacy's best kept secret, and I do believe that that is absolutely case. So currently, I am a commander in the United States Public Health Service. My current duty station is in the DC, Maryland, Virginia area. We lovingly call it the DMV. I'm specifically in Washington, DC, and currently assigned to the Federal Bureau of Prisons as their chief of pharmacy logistics support. If you would have told me in pharmacy school that I would have ended up in the commission corps and now working with the Federal Bureau of Prisons, I would have told you that you're just believing make believe. But like many others in pharmacy school, I was headed into retail pharmacy. I had done that, prior to pharmacy school and during pharmacy school for P1 through P4 years. I actually ended up signing on with one of the large pharmacies and secured a position my last year, my P4 year. But my life just ended up taking another path after I signed on. I was actually applied for and was accepted to a drug information residency at my alma mater, which was Mercer University College of Pharmacy and Health Sciences. So I stayed on board, with Mercer and did the drug information residency for that year. And that residency, I do believe, is what opened up so many doors for me. After that, it was during my P4 year that I found out about the public health service. So the application really does take a year to process. So I put my application in my fourth year of pharmacy school, and then it was during my residency that I learned that I had been professionally boarded, and I was able to go through the process of searching for a position that would hire a public health service officer. And I want to clarify that too, because it's sometimes confusing. There is the public health service, but we are employed by agencies or federal government agencies, specifically the Health and Human Services. And then there are other agencies outside of HHS, like the BOP and the Department of Defense, that will employ us. So after my drug information residency, it was the Department of Defense who actually offered me a managed care pharmacy residency. And then I commissioned with them, and the rest is history.
Wow, that is not a simple path. Thank you for sharing all that.
Oh yeah, like I told you, I never would have dreamed my P1 year or during pre-pharmacy that I'd be doing this. It's really cool.
Well, since you kind of talked about you not knowing that this was going to be the ultimate outcome for your career, when you started into pharmacy school, what was your goal? What did you think you would end up doing?
My goal as a pharmacist, I actually started doing pharmacy when I was 12 years old. My dad is retired Army, so he retired in Augusta, Georgia. I would do Red Cross with Dwight David Eisenhower Army Medical Center, Fort Gordon. And so it was then that I was like, oh, I mean, they're just constantly helping people after they've seen their physicians. I would just always see the conversations that the pharmacists would have, and it was so open. It wasn't rushed like you are in the when you're in the clinic. And so it was then that I was just like, oh, I mean, I can do this and I can help people and have meaningful conversations. And that's really what I wanted. So that's why retail kind of, fit into that mold for me. You could help people, just make sure that they're getting what they need in the community. But as you're aware, retail pharmacy long term, just it wasn't the right path for me. But that was my goal when I first started, was just helping large communities.
I must say, when I was going to pharmacy school, I don't know that I actually had an ultimate goal. I just knew that I liked to help people and I was good at math and science. And
Hmm.
when I graduated, there would be a job for me. I don't think I even let myself dream. But as I had experiences in first retail pharmacy and then hospital pharmacy, I got a taste for what I liked. I liked the hospital pharmacy, but it seems like at first you were kind of a retail girl. And
Hmm.
like you said, you accepted some sort of a position at a retail pharmacy, but then your plan changed as your career went on.
It absolutely changed. And I think something that I wasn't aware of going into pharmacy school is that its pharmacy is so multifaceted. There's just so many things that you can do with the degree in pharmacy. But in addition to knowing that I wanted to help large communities, potentially in the retail setting, I knew that I wanted to do it a different way. So I think this might be my way of doing it a little differently.
Yes, you are now helping prison systems, right?
Yeah,
So the
yeah,
Federal Bureau of Prisons. Can you
yes.
talk about what your duties are? What's a day in the life of Dr. Kendra Jenkins?
Sure. So currently, like I said, assigned to the Federal Bureau of Prisons, I work at central office in Washington, D.C. We have several federal institutions across the nation, but my job pretty much entails the procurement side, analytics, making sure that our pharmacies are stocked with the medications that they need, working with drug manufacturers. I'm constantly interfacing with them to make sure that our pharmacies are getting what they need on a daily basis. Pharmacy and therapeutic committee meetings, and just being a part of the pharmacy leadership team. We have a very wonderful team at the Bureau of Prisons. And what I like about BOP, even though I'm not in the field working at one of the institutions, they use their license to the tip top of its clinical capacity. So, we've got pharmacists in clinics, providing firsthand care to our adults that are in custody. And so working with them it's an honor and a pleasure on a daily basis.
Thank you for sharing that. It sounds like you don't have a direct patient care role at this time, correct?
Right, that's correct.
Even though that is not your role now, when you joined the Public Health Service Commissioned Corps, what other roles have you had that maybe you did have some direct patient care roles?
Like I said, when I first joined, I commissioned as a managed care pharmacy resident with the Department of Defense. First duty station was at Fort Sam Houston in San Antonio, Texas. So I was with the TRICARE Pharmacoeconomic Center. As part of my residency, I did go to clinic within the DoD system there at BAMC, what was Brick Army Medical Center. I think they refer to it as SAMC now, San Antonio Military Medical Center. So I would work in one of the clinics there, specifically focused on diabetes, and so that's the way I kind of kept my hand in clinical pharmacy. Then my duty station after the Department of Defense was with Immigration and Customs Enforcement, actually. So I was at headquarters there, but I also had the opportunity once or twice to go into the field and work in one of the detention centers. Clinically, I've kind of moved on to more of an administrative side of pharmacy, but I do try to keep my clinical skills sound by doing various, temporary duty assignments and even deployments that, make sure that I can still perform as a pharmacist comfortably.
I appreciate that because I understand that the Public Health Service Commissioned Corps pharmacists do get deployed. And
Yes.
the deployments are very interesting to me because these are opportunities that most average, retail pharmacists do not have the opportunity to do. Would you be willing to share a couple of your deployments with us?
I've been in 12 years now, and my first deployment actually wasn't until 2020 when COVID-19 started. Prior to then, I know several pharmacists that deployed to Ebola, Hurricane Katrina. Unfortunately, I was not able to do those, but when things first started with COVID-19, I was actually assigned after ICE, I was assigned to the CDC during from 2020 to 2022. So my first deployment was at Travis Air Force Base. I don't know if you remember, but the cruise ships, the quarantine there when things first started. I
I
was there.
remember that. Yes.
Yeah, so I mean, the very beginning, that was my first deployment, making sure that those travelers on the cruise ships, were taken care of. They did have to go through a quarantine period when they came back from their cruise because obviously, someone was affected on or infected on board, but just making sure that they had what they needed on site at the Air Force Base, and that once they'd gone through their quarantine period, that they made it back to their home safely. After that, like I said, I was assigned to the Centers for Disease Control and Prevention from 2020 to 2022. And one of the deployments that I really enjoyed. Now, I will say our deployments can be they're long hours and they can be very taxing, but each one has been very rewarding in one way or another. But the one with CDC that stood out to me the most was the Federal Retail Pharmacy Program. And that's the one where basically the goal was to make COVID-19 vaccinations available and accessible to the American people through pharmacies. And so we had what were called federal pharmacy partners. So you had your CVS's, your Walgreens, grocery stores, Publix, Safeway. We partnered with them to make sure that they had the vaccine disseminated to their pharmacies so that, Americans could get them and easily access them. So that one was just outstanding because it just shows how pharmacists can just do so much in the community. And I would say that pharmacists played a very large role in the COVID-19 vaccinations, and to be able to work with that on the back end as a pharmacist was just very rewarding for me.
It reminds me of a scene from Braveheart or something where Mel Gibson's character's on the horse with the sword and he's like, let's go. And you're kind of like the person that's making sure the vaccine gets out to these pharmacies and they're like the warriors that are making the doing the battle. So
Yeah,
hope you don't
yeah.
mind the comparison, but I mean,
No, no, not at all.
it's
As
a true
part of
leadership position.
it is, and we were a large team on the federal retail pharmacy program side. And since you said, I love that Braveheart comparison, actually, because part of our commission core song is "Silent War Against Disease," and so I think that you put that perfectly with that comparison. It really is, and when we win, and I think we won that one.
Yes. Oh, I think we vaccinated our way out of the pandemic. I don't know if you agree, but what do you think?
I think you might be right, Kim.
That was part of the solution for sure. Going back to the comparison about Braveheart, I remember I think there was a flag. Maybe it was on a shield or somebody had it on their horse or whatever. The Public Health Service Commissioned Corps also has a flag. Isn't that right?
You're right. That's right.
Yeah. What's on the flag? Do you happen to remember?
The um the anchor and caduceus is what's on our flag, and I believe, and I don't want to get this wrong, but it was the flag that was flown on ships that were quarantined, because we are a maritime service, and I believe it's close. Our flag is closely related to the quarantine because it's yellow. So yeah, and it just shows our roots in maritime service.
Yes, the Public Health Service Commissioned Corps is quite old. And when you said maritime, that reminded me of something Dr. Pam Schweitzer said, where it was the history went back to a long
Oh
time ago,
yes,
like 1880
yes,
or something like, or maybe
that's
1776.
that's right. We're one of the uniform services that not very many people know much about, but we've got a wonderful history.
Right. Yes. And a flag to boot. I am an amateur vexillologist, if you know what that is. I love flags. I
Oh
just,
really?
yes, yes. And I remember interviewing Renu Lal,
Uh-huh.
Lieutenant Commander, I believe, Lieutenant Commander Renu Lal, episode
Uh-huh.
123. I remember because it's the easiest one to remember. One, two, three. And she gave me this artwork, and it was the artwork from the flag. And I'm like, oh, this is so cool. I don't think I knew this existed. So I think I put that in the episode artwork for her episode. And, anyways, ever since then, I'm like, they are extra cool. They have a flag.
We do have a flag. Our flag is pretty cool.
Yes. I believe that our mutual acquaintance, Marisol Martinez, also Dr. Marisol Martinez, has a picture of herself with the flag in the background in her episode artwork, too. Can't remember the number. It wasn't as memorable. Sorry,
Not
Marisol.
one, two, three.
Not one, two, three. Not as easy to remember as that. But, anyways, I think that's great. And once I cook up your episode artwork, maybe you will be giving me a picture that will have the flag in it as well. Who knows?
I will make sure to do that. We want to carry on.
Let's do it.
Yeah.
Awesome. Well, I know we got a little bit off track there. Thank you for talking about your deployments during the pandemic. Is there anything else on the topic of deployments that you'd like to share?
Those were the two that stood out to me. So I think we're good there.
All right. Thanks for sharing. Now, also on the topic of deployments, I know that you have a family. Can you talk about how being a public health service commissioned core pharmacist works for your family, both in your regular duty job and deployments?
Yeah, so my family is everything to me. So I am married. I've been married for 12 years to my best friend. And without him, this career would not be possible because we do have two two boys, a 10-year-old and a 6-year-old. And when I'm deployed or, when I have to have a temporary duty assignment or travel, it is my husband who is home with them. And, it's hard enough when it's the two of us, managing the day to day. So I know that it's not easy, but he knows that my career is important to me and he respects my career and allows me to be great. So it is not easy by any means managing the deployments, which can range from 2 weeks to 2 months. But we work it out. Same goes, during the day to day, we kind of split split shifts. One does drop off, one does pick up. I typically do a very, very early shift because DC traffic is nothing to play with. I get in bright and early around 6 a.m. and I'm able to get home before the boys get out of school and get them. And then we start our evenings together and we do it all over again. So I try not to ever talk about work-life balance because I think that that term is used so frequently and I just don't think that it's possible. But what I've come to accept is that I'm a great mom. I'm a great pharmacist, and sometimes I'm going to be better at one than the other. And I just have to accept that. Sometimes I am the bestest mom. I'm at everything. But then there's other times I just can't be there because I'm being the best pharmacist I can be. And so I know that there can be a lot of mom guilt sometimes, and I feel that too. But I know at its core that I'm good at both and I intend to continue that vibe.
I want to echo so much of what you're saying. Pharmacists, we can be good moms, we can be good pharmacists. You can
Mhm.
have it all, just not all at the same time. And
Right.
I love that you talked about how you feel like sometimes you're doing better with one than the other, because
It's
I think
true.
that's how the pendulum swings sometimes.
It is. It is. And it's um maybe one day I'll be great at everything all at once, but I just haven't figured out the way to do that. Um with momming and wifing. And then there's also me too. I think I'm the one that gets kind of lost in the shuffle sometimes, but I'm getting better at that as time goes on as well.
The struggle is real. I
It
feel
is
it too.
real. Yeah, it is definitely real. And I wish that I wish that we talk about these things more because you never want, fellow professional moms, professional women feeling like they're in it alone because you're definitely not.
Thank you for sharing what it's like for you. And might I just say, it sounds like you have a healthy partnership with your husband, where he's a very
Absolutely.
supportive partner, supportive of your career and parenthood, his half of parenthood as well.
Yep, absolutely. I can honestly say he's probably better with the little ones than I am, but I could not do this without him.
You have certain challenges because you're a boy mom. Boys,
Oh yeah.
there's only certain things that moms can do. Having a man involved, having the dad involved, having a male role model involved, it means something.
It does. You cannot take that away. You are absolutely right.
Oh, the things that I could say. Like my husband wrestling with the kids and
He
playing.
does that too?
Yes, oh my gosh. I used to catch them playing this thing. It was called Pirates and something. And they acted like they were on a pirate ship and the bed was the ship. I
Uh-huh.
can't remember what it was called.
It's
And
so unsafe.
He would take them and just like slam them down. They looked like they were wrestling like on WWE. But I have these videos. Oh my gosh, those are so precious because they're ginormous now because my kids are 20 and 18. There's no way he could lift them now.
I know.
Good memories.
I know. I know. I try to stop them from doing it because somebody's going to get hurt, but they don't listen to me.
I think the worst thing that happened was my one son lost his balance when he was around 4, and his teeth, his two top front teeth, bit into our headboard. And forevermore, we had these two teeth marks in our headboard. It was a sleigh bed, a wooden sleigh bed. And
Yeah.
yeah, then there was that memory, but we have since gotten rid of the sleigh
Oh,
bed.
I was
And
about to say, do you still have the sleigh bed?
you
That is
know that every
perfect.
time I looked at that, I would have been thinking about that. But no, the sleigh bed is gone. Yes,
Oh, the memories. I'm trying to hold on to them. I know that they grow fast.
they do. Oh, I wish I could remember the name of that game. It was Pirates and something. It'll come to me after the interview, and I'll have to put it in the outro, as I call it. And you'll be listening to this later on. You'll be like, "Oh, that's what it was." Yeah. And then your husband will start playing it with your boys.
I won't tell him. I won't tell
Yeah, don't share this.
him.
Okay, moving on. Sounds like your spouse and your kids are all very supportive of you. And I've got to ask, since you have two boys that know what a uniform is, how proud are they when they see mom in uniform?
They don't call it a uniform. They call it my outfit. But they think that it's the coolest thing. And I try to make them think that, oh no, no, it's not you don't have to tell me I look great. But they every time it's like it's the first time for them. And they always invite me to the career days and to speak to their class. And that means so much to me because they're in this with me. And I love the fact that they understand what I do and they appreciate it.
Nice. Really nice. I think it's a beautiful uniform. I believe you share the same colors with the Navy. Is that
Yep,
correct?
that's right. That's right.
Yep. So the dark blue pants and the white shirt, all
Hmm.
the decorations.
Yep.
Yeah, it's very official
That's
looking.
exactly what they call it. Not medals, they're decorations, mommy. Do you have a new decoration? I love it. They're so sweet.
What are they called? Those little bars? Do you call
Yeah,
them bars?
the bars are medals or ribbons. Ribbons.
Okay.
Hmm.
All right. Well, I'm sure they are proud of you. And I know that you said you come from a military family. Your dad
Hmm.
was in the Army, you
That's
said,
right.
right?
Hmm.
Yeah. And how does he feel about your service in the Public Health Service Commissioned Corps?
There's not a day that goes by that he doesn't remind me that he knew that I would be the one that would, kind of follow his lead with that. Not necessarily in the military because we're not a military service, but in a uniform service similar to what he did. I think that he appreciates that. Yeah, he appreciates it.
Awesome. Awesome. I'm the one out of my two siblings, total of three kids, who wanted to go into the service. I didn't make it in. I have asthma. Everybody
Oh,
rejected me.
no, no
Yeah.
rejection.
Yeah. I got rejected, but I did work for, I guess you could call it a clerkship rotation, 8 weeks in college at the Federal Bureau of Prisons in Milan, Michigan.
No way.
Yeah, yeah. I don't know if we ever talked about that, but yeah, when we were doing our interview prep, I don't
Hmm.
think I ever mentioned that, but yeah, 8 weeks in a male federal correctional institution in
Yep.
Milan, Michigan.
Yeah. Yep. And Mylan is still open.
Yes, I'm sure you send drugs to them, medications, right?
Yeah. Yep. They order medication. So wow, what a great connection. I did not know that, Kim. That's so cool.
There you go. See, I get a very honest reaction from you when I spring this on you during an interview. This is great.
I love it. I love it.
Yeah, I had a great experience though, because I felt like the formularies are kind of small and
Yep.
the pharmacy staff, the medical staff have to be creative and resourceful and really pay attention to what is the goal here and work together. It was a wonderful experience.
It is. I'm sure it's the same now. Our formulary process is outstanding.
I can't say that anybody tried to get something that they needed and they could not. Although I did learn about how things escalate with the inmates where not behavior escalation, but if someone has cancer, for example, I didn't know that there are special uh, prisons for people who have cancer. Who knew?
That's right. That's right. We have our medical centers that manage those we call them care level 4 adults in custody. And so I'm telling you, top of the line care, I would say, from a clinical perspective.
Yeah, it was good for me though to learn that it's not just the end of the line. You go to one prison, and if you have a problem, that's where you stay forever, and they have to bring things to you. No, they can send you out. And anyways, it's a system, and who knew? Unless you
Exactly.
work in it, you just
Yeah,
don't know these things.
that's right. I'm so see, like I think it's so great that you had that experience. Not everybody gets that experience.
One of the most interesting things to me was spending time in the dental department because that was where I learned about a lot of things that I don't think most pharmacists would learn about. One of them, I know this is a negative thing, but it was about the harmful effects of drugs on teeth.
Hmm.
I didn't know about, meth mouth, and I had never met anybody who at the age of 22 had no teeth before. No teeth at the age of 22, had to have all
Hmm.
of them pulled, had never even been to a dentist before. There's all kinds of things that it really opens your eyes to. Like some people do not have the same privileges that I have. And I need to take that information, and as I go forward into the world, if there's an opportunity for me to refer somebody to a place that accepts no insurance patients or help somebody get on Medicaid so they can get dental insurance, then I need to realize that there are people like that out there. So the
Hmm.
prison really opened my eyes to dentistry issues.
Yep. No, I agree. The population, it it will definitely open your eyes.
Yes, and the effects of certain medications on dental uh, features. For example, calcium channel blockers can cause gum swelling.
That's
I got
right.
to see that firsthand. You read about it, but you don't get to see it and
Right. It's
how far,
different when you see it
yeah,
clinically. Yep.
yeah, how far down the gums get pushed. And then the teeth underneath are whiter because they haven't been exposed to food and, wear and tear. So when they change from a calcium channel blocker to a beta blocker or some other agent, those gums recede then, and you can
Hmm.
kind of tell a difference from where it was and where now it is. It's very
Right.
interesting. Only in the prisons, right?
It's a lot of interesting stuff.
Yeah. I know that you have been in the commissioned corps for now 12 years
Hmm.
because you mentioned that earlier. Can I ask, what are your plans after you leave, maybe at 20 years or more? What's your plan?
I actually have a countdown of when I can retire. Um, I love volunteering, being in the community. I would love nothing more in 8 years, 6 months, 29 days, and 10 hours than to just volunteer for the rest of my life. I've actually already shared that with my husband, whether it be through, sorority or one of our family organizations that we're a part of. Volunteering and giving back is so much a part of who I am. I would definitely want that to be a part. I don't know if I would retire and then go back to work right now. I'm thinking that I want to retire, and volunteer. Retire, if that's a thing.
That's a good first step, just
Yeah.
setting a retirement date. I love that you
Yes.
have it down to the hour.
To
I
the
don't think I've ever
hour.
talked to somebody who has it down to the
I'm a
hour. Way to go.
planner, Kim. I can't help it. I'm a
I
planner.
see this now. No, that's great. That's great. And the fact that you do want to retire at 20 years, that is a good thing. I have two uncles and an aunt who are pharmacists, and they
Hmm.
used to tease me all the time when I was going into pharmacy school that pharmacists never retire, they just die. And I just thought, no, 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 that's not going to be me. I need to set a retirement age,
Oh,
which for me
yes.
is going to be 55. 55 and 364 days, as long as it's not a leap year.
See, you're worse than me.
I
No,
have it down to the day, but not the hour. And
yeah.
yeah, I would like to do certain things when I retire, which involves a lot of what I'm doing now, being a medical narrator, podcast host, maybe coaching, things like that. But I am not going to be like my uncles where it's expected that you just work until you die. No,
No,
thank you. So thank
no.
you for sharing that you have a plan and it's okay to retire and then do something else.
Absolutely. I mean, the traveling with the family. I mean, there's so many things. I mean, I love my career, um, but I love other things too.
Very good. Well, I hopefully we're still in touch because hopefully this podcast will never end. Like I said, I'm planning to podcast into my retirement years. And I think it would be really interesting to follow up with all these commissioned corps officers and find out what they do when they do retire.
Oh, you
Because,
should. That would be
yes,
great. That would
I
be
think you
wonderful.
would be very inspirational for other people who are in the commissioned corps just to hear, what you're up to. Because people want to be what they can see, and what they want to be most is retired.
Right. No, absolutely. I think that's a great plan.
Absolutely. Well, thank you for sharing your plans with me. And the next question has to do with students.
Mhm.
What has your impact on students been as you've gone through your 12 years of service?
Oh, I love students. During my first residency, I was actually an adjunct at Mercer University. So as part of the residency, I would, do certain do certain lectures in the practice of pharmacy course, and I really enjoyed it because that's just another way to give back, especially being 1 year removed from school. The students, they can connect to you more easily, because you're not so far removed that you can't relate to what they're going through. It's just like, I just got done with this. How are you managing this now? So adjunct there. And then during my residency with DOD, I had an experiential learning section where I would do lectures with the University of Incarnate Word in San Antonio, Texas. So definitely enjoyed that. And I've also had the opportunity, especially with Dr. Martinez at CDC. Students are important to her too. So she would always have a student on board. And through her students, I would be able to, precept. I think what both of us enjoyed too is that we don't learn a lot about managed care during pharmacy school. And so I take that as my opportunity to, just let students know that there is another world outside of what you're thinking, what the only things that you're thinking that you can do in pharmacy. Like managed care and drug information are huge and they're fun. So I definitely take precepting students and mentoring, so important to me as an opportunity to open doors, to answer questions, and just kind of, you know, be a place where students and pharmacists, young pharmacists can talk.
Being a resource is important because pharmacy students, like you were saying, sometimes they get thinking that the only two paths are retail and hospital. And when you
Hmm.
expose them to these other ones, then I think it really expands their minds.
It does. It does. And I've seen it firsthand where, someone goes through a rotation, had no clue what managed care pharmacy was, and then end up doing a managed care pharmacy residency. And I'm just like, oh, that's a win. That's a win.
One thing that the public health service has to do with, from what I understand, is the 340B pricing. Is that correct?
That is right. That program is housed at HRSA, Health Resources Services Administration, and it is the 340B program that the pricing for certain hospitals or clinics that are underserved.
There's a lot that a civilian student, so to speak, could learn from interacting with somebody in the public health service who is part of these programs. You don't have to go into the public health service or apply if you don't want to, but you could still learn from them. Just to clarify for any students listening, you take on students or work with students who are not in some sort of a track to become a public health service commissioned core pharmacist as well, right?
That's right. That's absolutely right. Like for example, the immediate past director of that program, I know for a fact, interacted with students and, can share, what this program is. There's so many opportunities for that within the service. Even outside of residencies, just those rotations that are available. to introduce you to the public health service as well as agencies that employ our officers.
That's all good info. And 340B is such a hot topic right now, I feel like.
It is. It really is.
Kendra, can you tell me about some of your challenges as a pharmacist in the Public Health Service Commissioned Corps?
It's a positive and a negative. I'm one of those that I'm kind of get it done. I have tried to do that in the past as a commission corps officer, and you burn out quickly. And I not just as a commission corps officer, I would say that in any pharmacy careers, treating your career as though it's a sprint instead of a marathon. And I know that that's kind of trite, that's used often, but
Oh,
it's
it's good
true.
advice. It's good
It's
advice.
true. Just trying to knock down all the hurdles to get to the end very quickly, and you end up in a not so good place. That would be one thing that is like a pitfall to avoid, as a commission corps officer or just a pharmacist in general, is, you want to be ambitious, you want to perform well, produce quality work, but you have to balance yourself, if possible. Because if you're going to do a 20-year career, there's really no reason to try to do a 20-year career in 5 years, which it's just not reasonable. Um, so I would say that I think that because there is the rank and promotion structure, just like there is in, the military services, all uniform services. Not saying that I've done this, but I do think that just in general, it's easy to focus solely on that advancement and that promotion aspect instead of focusing in on what our true mission is, which is serving underserved populations. And so I would definitely say, just to level set with yourself, even when things are hard, just remember what our goal is. And that kind of resets me and puts me back on track when things get hard, or when I'm, in a not so good place professionally, which it happens. It's not bad. It's not saying that, you have a horrible workplace or anything like that. Your career ebbs and flows, and sometimes you're in a very good place and sometimes you're not, but you have to refocus yourself.
I appreciate what you were saying about the marathon and the sprint and promotions and the achieving personal fulfillment and remembering the mission of the organization. There was a lot of great advice right there. I think we all have to set our own personal yardstick of what it is that we're trying to do with our careers.
Yeah.
I hear you just saying that you love to serve
Hmm.
and you believe in the mission of the Public Health Service Commissioned Corps. So for me, I feel like what I'm hearing is you're saying, this is what I want to get out of it. And this is how I feel like I'm succeeding.
Hmm.
I'm treating this as a marathon, not a sprint.
Right.
I'm getting promoted, but I'm not trying to do 20 years in five.
Right.
And I am serving others, which is what I enjoy to do.
Yeah.
That's all. Like, I feel like you're succeeding in your career. Do you feel like you're succeeding?
Not all the time. But I try. I try my hardest. I do think that ultimately I will hopefully be successful. But I don't feel that way all the time. I always feel that there's areas for improvement or things that can be done more efficiently or better. But as long as I'm trying, I try not to be too hard on myself.
I appreciate your ambition. I do. Yeah. I think we all have things that we get used to, and it's almost like we set the bar, right?
Yeah.
And then we almost start looking at the bar that's right above it, and we want to be there too. And
Yeah.
I don't think we can help that.
Yeah, that moving the goalpost, it's difficult. It does make life difficult, but I think that as pharmacists, that's just kind of who we are.
Yes. Some people are perfectionists, and some people are, like ladder climbers, and some people are challengers. Everybody's got their own personalities, and
Hmm.
depending on our own personalities and what our goals are, that's how we get the feels. We get
Yeah.
the feeling that we're doing enough, it's enough. And Yeah, but like you were saying, there's areas that you think you could improve on. I get that. I get that. I certainly feel that way in my life as well.
Yeah.
One of the things that you talked about was promotions.
Hmm.
In order to get promoted from, I believe that when you enter the Public Health Service Commissioned Corps, you're a captain, correct?
Our structure is a little different. We come in, pharmacists come in as O3s or lieutenants.
Lieutenants. Sorry, I
Yes.
messed that up.
No,
You come in
you
as a
did not
lieutenant.
mess it up because in the other services, an O3 is a captain.
Okay.
But in our service, an O6 is a captain. So it's just different. There's the sea services and the land services. Their rank structure is, officer, but they call different ranks different names. It's confusing.
It is a little bit. And I know what you're talking about with the O3 because when I was looking at going into the Navy, that's what I would have entered at was an
Yeah.
O3.
Mm-hmm.
For anyone who wants to enter as a lieutenant, as you
Mm-hmm.
said, and wants to achieve a different rank, which you are currently a commander, a
That's right.
CDR, right? Commander.
Yes, that's right.
What does it take to get to that level? Deployments, certain years of service, moving? I mean, how does one advance?
All of the above. Like I said, the you come in, as a LT, there's just certain expectations of your, performance. Performance in your job is 40% of your promotion. So, if you're doing a good job, you're producing quality work assignments, that is your 40% right there. And then there's other things, as I mentioned, coming into the commission corps, it's kind of like having two jobs. You're a commission corps officer, but you also have your duties and responsibilities at your duty station. So the 40% is how you perform at your duty station, but there's also expectations that you have as a commission corps officer. What are you doing to service the corps? So, like you mentioned, deployments, activities within the corps, within we have them, what are they called? PACs, our professional group. So for pharmacists, it's called PharmPack. We also have, other advisory groups that are commission core related. So just your level of effort in each one of those categories, in addition to your mobility, your movement, you could technically in the core, unlike in the military services, you could stay in one duty station for your entire 20-year career if you'd like to. But to increase your chances of promotion, you would either want to increase your level of responsibility at that duty station or change locations geographically. So all of that factors into your upward mobility in the core.
I see a lot of strategy in that promotional structure. You have to really be checking the boxes in order to feel like you can ask for that promotion or advance.
That's right. And we're told not to, because we do have what are called benchmarks that you have to meet. We're told not to check boxes. That would be another piece of advice that I would share, just as you're going through, the ranks trying to get promoted, is do things that you enjoy and it feels less like work. And naturally, you'll, check those boxes, but don't just do things to check the boxes. That makes your life really hard and miserable, especially if you're not enjoying what you're doing.
Great advice. You opened up saying that you're in the DC, Maryland, Virginia area.
Mhm.
Can you tell me what kinds of relocations you've experienced in your 12-year career?
Sure. So I started off, my husband and I moved from Atlanta to San Antonio, Texas when I first commissioned. So San Antonio was my first duty station. Then after that, after my residency, DOD wanted me at headquarters at the Defense Health Agency. So that's how we ultimately ended up in the DMV area because that location is based in Falls Church. And then after that, I've kind of just moved around agencies within the DC area. So After I left DOD, I was with Immigration and Customs Enforcement, which is in DC. Then I was with CDC. Most people think that CDC is in Atlanta, but CDC actually has locations all around the country. So I was able to stay in DC while assigned to CDC. And now I'm with the Federal Bureau of Prisons in DC as well. So I've had some geographic moves as well as movement within the agencies and then around agencies as well. And I'm hoping that this one will be my last one.
I was just going to ask
Were
that.
you?
What does the future hold?
Yeah, no, I kind of front loaded the movement, the geographical movement. I've been with BOP as my fourth agency, and I'm hoping and I'm almost, well, I don't want to say positive because I've said that about duty stations before and I've been wrong, but I love my job. I love the leadership group that we have, and I hope to be here for a very long time.
Best wishes for fulfilling that desire.
I appreciate that.
What advice do you have for currently practicing pharmacists or new graduates? This can be general advice or something specific to your role in the Public Health Service Commissioned Corps. The floor is yours.
I would say use pharmacy school as an opportunity to learn more about non-traditional roles in pharmacy. I don't think that I did a good job of that during pharmacy school because I was focused in on what I thought that I wanted to do, not realizing that pharmacy just opens the door for so many things. So definitely explore federal agencies during your rotations. Take that opportunity to do that Indian Health Service assignment or BOP assignment, while you're in pharmacy school, as well as with manufacturing companies or those that offer fellowships, reach out and, try to understand, what these opportunities offer during pharmacy school so that when you get closer to your P4 year, you may have a better idea of what it is that you want to do and what's available to you. The second thing I would say is don't settle because if you settle, you're not going to be happy. And ultimately, think with the end in mind, think about what you want to do long term, and not just what works immediately once you graduate. Don't be short-sighted in making those decisions.
Great advice, and thank you for sharing that.
Sure.
Can you tell me, for anyone who is already out there practicing and is not happy with what they're doing, and they're listening to this interview thinking, this job might be right for me. I've heard about all the different locations and agencies I could work for. I want to work for the Public Health Service Commissioned Corps. Kendra, would you recommend your job to another pharmacist?
I honestly would. I don't want to sound like the recruitment specialist for the PHS, but I really I do love the core and it has opened so many opportunities for me, not just as a pharmacist, but just leadership opportunities. So I would definitely recommend it to pharmacists or other healthcare professionals that want to take a more non-traditional path.
Kendra, 100% of the Public Health Service commissioned core pharmacists who have been my guests on this podcast have said they would, yes, recommend their job to
Okay,
another
good.
pharmacist.
Good.
So,
Okay.
way to be part of the majority.
Okay. Sounds good. Sounds good.
Yeah, absolutely. Everybody says it's the best kept secret in pharmacy. And it sounds like you agree.
I agree. I agree. With any position, there's always going to be pitfalls, struggles, and PHS is no different, but it is a wonderful career.
The opposite of pitfalls and struggles and challenges is having favorite things. So, what is one of the good things or one of your favorite things about being a public health service commissioned core pharmacist?
One, serving, which is the absolute best. And then the relationships. I'm an introvert, like clearly an introvert, and probably will go to sleep immediately after this podcast interview because just my energy will be gone. But just the friendships that I've gained that are just so genuine and so pure. You mentioned, Captain Martinez, Commander Robertson, just all of the camaraderie. It's a good group of individuals, and it makes it even better because we're concerned about each other, we're concerned about each other's families, and it really does offer a sense of community. So serving and then the relationships that I've built as an officer.
I love that. That's wonderful. Thank you so much for sharing that you've built these relationships and you have a favorite thing. There are some retail pharmacists out there who are so unhappy they can't even think of one thing they like about their jobs,
I
you know?
know, I
So
know.
God bless you if you are a retail pharmacist listening to this, but if you're interested in the Public Health Service Commission Corps, you can serve all kinds of different people, whether you're in administration and serving other pharmacists
Hmm.
or being a pharmacist who has direct patient care roles. It sounds like you could do that and you
Yeah,
can build relationships with other pharmacists, which is really
absolutely.
cool.
Absolutely. It's a wonderful thing.
Now, Kendra, some of my other Public Health Service Commission core pharmacist interviews have included this kind of like, what are your hobbies section? So,
Uh-huh.
do you mind if I ask if there's anything that you're able to do for fun that having the role that you have allows you to do because you work kind of Monday through Friday, no weekends, no holidays?
Yeah. Well, technically we're 24/7, but I mentioned earlier that family is super important. Um, we travel. We travel quite a bit, vacationing and traveling with family or just my husband and me, which we haven't done in years, but we're able to do the last year. Also, I love dancing. Dancing is just everything. It's just a release for me. So, if I can, even if it's at home, just the opportunity to have fun and dance with family, or by myself, that's one of my hobbies. Now, the other stuff that I used to enjoy, reading for pleasure, I'll get back into that later on. But right now, traveling and dancing are my go-tos.
Traveling and dancing are fine hobbies, even if you're dancing because no one's around.
Exactly, which happens frequently.
That's awesome. I've heard some pharmacists say that when they're trying to elevate the mood of their staff, they
Hmm.
turn on a song that everybody likes to dance to and they have an impromptu dance party.
Hey, it lifts your spirits.
Yeah. Yeah. It's good to hear you in agreement with that practice.
Absolutely.
All right. Well, is there anything else that you want to mention about being a Public Health Service commissioned core pharmacist?
I think that I have shared a lot about PHS. I do think that it's a wonderful career, and I will leave it at that. You have to look it up for yourself on usphs.gov.
Nice. I like how you left that. I think, yes, my listeners who are interested, whether you're a student and you want to do isn't it called a co-step program?
That's right. That's right. We have junior co-step and senior co-step programs.
There you go. Either that or becoming a commissioned core officer. You can check out either of those options on phs.gov. Dr. Kendra Jenkins, thank you so much for being here on the Pharmacist Voice podcast to share how you use your voice as a public health pharmacist. You take care.
All right. Thanks so much, Kim.
Thanks again to Commander Kendra Jenkins for being my guest today. Public Health Service Commissioned Core Pharmacists have interesting jobs, and they make great guests. I love hearing all about their jobs, their deployments, their family life, their life philosophies, and all the rest of the story that you just don't get unless you ask. On a different topic, I feel like I have at least 2 or 3 things to follow up on after that interview. One is the episode number for my interview with Captain Marisol Martinez. That was episode 209. That interview was, of course, memorable. Yes, it was memorable. The episode number, unfortunately, was not. I could not recall it during our interview. So there you go. If you are interested in listening to my interview with Captain Marisol Martinez, check out episode 209 of the Pharmacist Voice podcast. There's a link to episode 209 and all of the links to interviews that I have published with Public Health Service Commissioned Corps officers in the show notes. You can find the show notes on thepharmacistvoice.com. Including my interview with Commander Kendra Jenkins today, I have now done 7 interviews with Public Health Service Commissioned Corps pharmacists. I hope to continue to interview commissioned officers in 2024. I would like Public Health Service Commissioned Corps pharmacist interviews, of course, but I'm also interested in an interview with a Department of Defense pharmacist, too. If you know someone who's interested or you'd like to nominate yourself, please reach out on thepharmacistvoice.com. That's thepharmacistvoice.com and use the contact form. 2 other things I want to follow up on are the first one is the wrestling game that I mentioned when we were talking about being boy moms. My husband used to play a game called Hurricanes and Pirates with our sons. I couldn't remember the word hurricanes. It was Hurricanes and Pirates that he played with our sons when they were toddlers and maybe when they were kindergarten age. They got big fast, and then we couldn't throw them around anymore. We both liked wrestling with them, but Hurricanes and Pirates was a dad and his boys type of thing. I just watched. Our bed was the pirate ship, and the hurricane was making the ship unsteady, if you can imagine this situation. You know, everybody's pretending, and the wind, so-called wind, was tossing the boys around. So pirates and hurricanes, the bed was the pirate ship, the hurricane was blowing the boys in the bed around. And then my husband, I don't know if he was the pirate king or what, he's probably not going to listen to this, but he was definitely tossing the boys around for fun, and everybody loved it. It was fun. If you have young children, play games with them, have fun, and enjoy your time with them. My boys are now 20 and 18 years old, and they're taller than me. We certainly cannot toss them around now. We enjoyed our time with them when they were young, and we still enjoy time with them now. But man, we've got the memories now. Even though the one kid face planted into the headboard, we had a great time playing. One last loose end to tie up here. I have 2 uncles and an aunt who are pharmacists, and my Uncle Tom especially used to tease me that pharmacists do not retire, they just get old and die. This, by the way, was coming from somebody who is now retired. Both uncles and the aunt are all retired happily, and they are still alive. So I just want to give you hope. If you're listening to this and you're a pharmacist, it's not true. Pharmacists don't just get old and die, they retire. Uncle Tom and Aunt Janet retired after, I believe, 40 years with the same company, St. V's in Toledo. So again, pharmacists don't just get old and die, you can retire too. And you could start a countdown for your retirement too, just like Commander Jenkins did. That's pretty cool. All right, as we start to wrap this up, I just want to say that I am very glad that I had the opportunity to talk to Commander Kendra Jenkins about being a mom, being a pharmacist, and trying to do it all, and then retiring someday. I hope you enjoyed our conversation too. Thank you for listening to episode 260 of the Pharmacist Voice podcast. Please visit thepharmacistvoice.com to read the show notes. In the show notes, you'll find Commander Kendra Jenkins' full bio and her LinkedIn link. Go ahead and connect with her if you are interested. There are also links to the other interviews with Public Health Service Commissioned Corps pharmacists that have been on this show, links to the United States Public Health Service and Junior Co-Step and Senior Co-Step programs, my social media links, and more. Lots of links today. If you know someone who's interested in a residency or a career in public health, please share this episode with them. And if you like this podcast, please subscribe to or follow the Pharmacist Voice podcast on your favorite podcast player and YouTube to get each new episode right when it comes out. Join me next week, January 19th, 2024, as I celebrate 4 full years in podcasting. Can you believe it? It's my podcast anniversary. I'll have some stats and some information about the direction of this podcast as I start year number 5 of the Pharmacist Voice podcast. Thanks again for listening today. I'll talk to you next Friday.